Hi everyone, I'm Britt Fallon. I'm the beauty director here at NewBeauty magazine, and today we are going live for another episode of NewBeauty Talks, and we will be talking all about smile makeovers with Dr. Joseph Field. He is a cosmetic dentist from Los Altos, California. So I'm just going to wait for a few more people to join us, and then we will get started. Hope everyone had a great weekend, and we're getting the week started with some smile discussion, which I love because I feel like, we're getting close to the end of the year and everybody has a New Year's resolution, and definitely teeth whitening is really big, is a really big one. So I know I would love to do some of those things very soon with my own smile. So I'm excited to get some information from Dr. Field. We're going to go ahead and get him in here. Just connecting now. Hello.
Hi.
How are you?
Good. How are you doing?
I'm doing well. Thank you for joining us. I just introduced you to everybody, but I'm going to go ahead and do it again. This is Dr. Joseph Field. He is a cosmetic dentist out of Los Altos, California. And we are so excited to have you here today for another episode of NewBeauty Talks. We're going to be talking all about smile makeovers and smile restoration. And I was just saying how this is such a good time of year to have this conversation because we're going into a new year and everybody's looking at what they can do to, get a little extra pep in their step and a little boost of confidence. So I'd love it also if you can just give us a little bit about your background and where your practice is located as well.
Yeah, happy to. So I'm in the heart of Silicon Valley here in the Bay Area, a town called Los Altos. So a lot of people are familiar with Palo Alto, which is where Stanford is, familiar with Cupertino, which is the headquarters for Apple. I'm right in the middle of those two in Los Altos, it's my hometown. This is where I grew up. So I feel
Wow.
very privileged and blessed to be able to practice dentistry where I'm from.
I feel like you don't hear that very often. I feel like everybody moves there for work.
Yeah, it's not a lot of creativity, I guess, on my part. I mean, I love it here. This is, it's an awesome place, and fortunate enough after I finished dental school at USC to come back here, come home, and be able to create beautiful smiles here in my hometown.
So I'm curious how you got into dentistry in the first place. What led you down that path?
Yeah, interesting story, actually. So I was a mechanical engineer major, so not quite the usual path. And I loved, with mechanical engineering, the CAD design, this program called AutoCAD that we use. I really enjoyed the design part of engineering. When I was in undergrad, I left college for 2 years and did a service mission in Colombia. And while I was there, I was exposed to this group called Operation Smile. And their focus is, as their name cogitates, is creating smiles for people. And so, especially dealing with a lot of like cleft lip, cleft palates, etc. And I was just really impacted with how life-changing the work they were doing was. And so I got home and, as I'm doing my engineering, I'm like, well, this is fun. I love this, but, can I change a life the way that I could with dentistry and creating smiles? And that's what kind of started leading me down this path.
That's awesome. I've never heard a story like that. I feel like I was kind of half expecting you to say that, you come from a line of dentists in your family, because I feel like that's what I hear most often. But
Super
that's really
common that
interesting.
way. Yeah,
What?
I'd say that's the most common route. I mean, it's a very generational industry in a lot of ways.
Yeah.
So I broke the mold there.
No, I love that. And I'm very familiar with Operation Smile. And if anybody's listening that hasn't, checked out their website and what they do, that you should, because it's amazing what they do. So, well, fantastic. I also wanted to see if you could explain to everybody listening what the difference between a DMD and a DDS is, because we can't, we see these credentials listed at the end of a dentist's, name on their practice, on their coat. And I'm just curious if you could tell everyone what that means.
Yeah, interestingly enough, they're the same thing. So DMD, DDS basically is the same thing. There's a few schools in the country that still use DMD cogitations. The majority use DDS, but they stand for the exact same thing. what really matters is what comes after that. So those are the other credentials that people go on and get with advanced education.
Okay. And so for example, so what are your credentials?
So my first one after DDS is I'm a fellow in the Academy of General Dentistry. And then I'm a fellow in the American Academy of Implant Dentistry. So these are all these credentials that come after it.
Okay.
I'm a fellow of the International Congress of Oral Implantologists, and I'm a diplomat in the American Board of Oral Implantology.
Wow. Wow. Quite the resume.
But yeah, that's me.
Okay, amazing. So one of the things that I have learned that's unique to your practice is that you only do like full mouth reconstruction and smile makeovers. Is that correct?
That's correct.
So people wouldn't come to you if they needed a filling done or if they wanted to have a cleaning?
No, they're better off with someone else because I haven't done a regular filling in a long time.
So how did you decide? I mean, I haven't ever, gone to a practice like that. So how did you decide that you wanted to do that?
A few reasons. And basically, again, it started back in dental school. So I was very fortunate to be exposed to some incredible clinicians when I was in dental school at USC. And it changed my vision of what dentistry could be and how impactful it can be. And so as nice as we can make fillings, I rarely have a patient in tears after having a filling done saying, wow, that changed my life. That was amazing. Right. And not that there's anything wrong with that, because it's a very important thing. And I have, part of my team, my doctors that do that work. It's crucial to our health. But for me, there wasn't a lot of satisfaction in joy in that. And I like to do things that were really life-changing things for people. For me, it's very difficult clinically, the work that we do. And I like the challenge of that and knowing that I can do things that not many people can do.
Yeah. And speaking of, so full mouth reconstruction, we use that term a lot in NewBeauty. We write it about a lot, but the average person might not know what that means. Can you explain what that entails?
Yeah. I'll tell you, there's kind of a division of that. And I'll talk about what I see in my practice when patients come in. So I'll have patients come in and say, look, my mouth's a wreck. I just need the whole thing fixed. And so they come in with that understanding. And I'll get into the clinical kind of details in a second. The other delineation or segmentation of that group are people that come in and say, well, I want my teeth to look better. I want a smile enhancement, or maybe I'm missing a tooth as part of this, and I just want things to look nice and feel better. And then when we dive in with that group, we see, well, the reason you got to this point is because the system's not working right. So the system's broken down. Lots of chipping and wear, and really the bite will start to collapse over time as we lose that functionality of our teeth, which creates a whole bunch of issues. And so that's actually the more challenging group, because that's the group where, hey, yeah, we can make it look great, and then maybe they'll go somewhere that they know how to make it look great, and it looks great for maybe 6 months to a year, and then they just start breaking things again, right? And so it's a really important thing to be educated on, understanding, well, there's a system, and the teeth are supposed to work the way they work on purpose, right? So yeah. Those are the patients I really spend a lot of time just going through the whole process, educating them, showing them our workflow, etc. And really this full mouth reconstruction involves, certainly there's some veneers as part of it, usually in the front, just making things look great, but it really is rebuilding the functionality of the teeth, making sure the back teeth function properly, the bite is the way it needs to be, the forces are balanced across all the teeth. So that's what goes into a full mouth reconstruction. Oftentimes implants are involved in that as well, and that's part of what I do.
Okay, so I'm really curious about the bite, because that's something that I deal with. I have some TMJ issues and stuff. So I think what I would love the message I would love to get across to people is that full mouth reconstruction doesn't mean that you go in and you have to have veneers, right? Or you have to have every tooth touched. If someone comes to you and there's just a bite problem, could you fix that and then you don't have to do everything else?
Yeah.
Okay.
So let's say someone comes in like, hey, my front teeth are great. Like, I'm really happy with my smile. Maybe we whiten them a little bit or something like that. But I can't feel like I'm chewing properly. I can't use food properly, etc. So that's when the bite reconstruction part comes in. So
Okay.
sometimes we're not even doing a full mouth reconstructions. Maybe we're doing what we call a posterior or a back tooth reconstruction, and just reestablishing that bite on those back teeth.
Okay, that's interesting. I think I need to look into that personally after this. So another thing that's unique to you that I've learned is that so you are cross-trained in both the surgical side and the restorative side of implant dentistry. Is that right?
Yeah.
Okay.
I,
And
I
what does that mean?
it's like there's so much stuff you do. So I'll give you a little bit about me. I don't know if it's ADD or what, but I love just challenging myself and developing and being able to provide the ultimate care to my patients in the cases that I do. And the implant side to what I do came along is as I'm doing these reconstructive and restorative processes, when, again, as I mentioned, a lot of times implants are involved in this. And what I found, I mean, I have great surgeons that I work with, et cetera, but when you add another kind of doctor to the flow of these cases, it makes it a lot more complicated, usually more expensive, more visits, et cetera. And so I spent 8 years training to do implant dentistry as well, so that when I'm doing these reconstructive cases, if implants are needed, I can make sure that my level of care of implants is equal to my specialists. And that's why I took it very seriously. So there aren't many people that do that. It's a lot of work. It's a lot of training, a lot of different nuances. But for me to be able to really provide the ultimate care for patients and be able to do it in my hands, and I'm kind of a control freak, so I can have control over every aspect of what's happening. It's a big deal.
Yeah. So would you say implants are one of your specialties then because of that?
It is. And it's funny because it's the majority of what I do is cosmetic reconstructive work. And then just from a percentage standpoint, and then below that is implants from a percentage standpoint, just because usually it's like maybe there's one implant involved in what we're trying to do. So it's so much more cosmetic, aesthetic, reconstructive, but then the implants come part of it.
Okay. And can you explain, like, who would need an implant?
So either the tooth's missing already when I see them, or it's a tooth that maybe has had a root canal, for example, and maybe the tooth is cracked now and needing to be replaced. And going back to what I was saying earlier with the bite collapsing and things happening, that happens pretty commonly once our system starts breaking down. Now we have these compromised teeth that have had root canals, et cetera, and just the bite forces are so much higher that now we're going to get cracking, and we are ended up having to replace a cracked tooth with an implant.
Yeah.
And it goes all the way to the extreme of now I have patients that they either have no teeth or the teeth that they have left are falling apart, and then we're replacing their whole mouth with implants.
Oh my gosh, that's a big job.
That's a big job. It's way more involved.
Wow, that sounds like painful too.
It's not. Well, I can walk you through. And actually, I love this pain question. So you brought up pain, so I'm gonna talk because this is a big deal for me.
Yes, please do.
I'm a baby. I'm a terrible patient. Anytime I have to get and actually I have veneers on my lower teeth. I have obviously other stuff that's been done. I hate being in that dental chair. I really do, which is ironic for the stuff that I do. Because of that, I did 2 years of training to do something called IV sedation. So IV sedation is what they use for common medical outpatient procedures. It's not a general anesthetic where you're, out and you're intubated. It's all that scary stuff. It's what we call a twilight sleep. Mm-hmm. And so you're in this kind of twilight sleep, relaxed state, and we get all the work done while you're very comfortable. You wake up and it's over. And so that's the way that we're able to really manage the pain during the process exceptionally well. And then with the IVs, we're able to give medications via the IV that help the recovery process. So my patients are often surprised of, hey, that really wasn't bad.
I was just going to say, though, that's what I was going to say about the recovery, though, because maybe you're eliminating the pain during, but like, if you had your whole mouth done, are you in, do you have some downtime afterwards where you're in pain for a little while after?
So if we're doing, say we're just doing it on teeth, right? And we're not doing the implant part. typically I'll tell my patients, I say, hey, take that day off. That's a good day to just relax anyway. This is a long appointment, usually with sedation. Next day, they're back at work 100%. Typically the procedures I do, any discomfort's managed with Tylenol and ibuprofen, not too major.
Nice.
When we're talking about the surgical reconstruction, that full mouth implant reconstruction process, a little bit more involved, and still taking the day off, still able to go back to work the next day, but you're going to have more swelling, potentially some bruising. I mean, it's more of a surgical procedure, so there's a bit involved there.
Okay, and I think everyone would assume that, you're not going into it and just walking out with no, that is a big procedure.
Yeah.
So there's another procedure that you offer called Teeth in a Day. And, obviously from the name, we can assume what that means, but I'm really curious to find out if that is what it means, and how that works.
So that's a coin phrase on this implant reconstruction.
Okay.
So basically what that means is when you come in and if your teeth are already missing, like patients that are in dentures, or if they're needing to be missing all their teeth, or there aren't many teeth left, we can do all the procedure, that whole work, put the implants in place, and then put what we call a bridge that attaches to those implants, all done in one day. So that's our Teeth in the Day protocol. What I'm very clear with patients, and people sometimes don't understand when they hear this marketing that's out there, those are just temporaries, right? Those are provisionals, and that's an important part of the process because we need to test drive, right? We need to test drive the smile, test drive the bite, etc. So that's the classic kind of Teeth in the Day. But also when we're doing cosmetic work, the veneering work, that's also kind of a Teeth in the Day type approach. Because with that, we do all the prep work, we take all the digital scans we need, and then you leave with the temporary veneers in place that day. So same thing, we're test driving that new smile right away.
So I'm curious if you could tell me more about the digital design. Like how has dentistry evolved to the point that we are at now? Like what have you seen just in your tenure with what you're able to do now with technology?
Yeah, so for me, the digital smile design, I call that a silver lining of the pandemic for my practice. And I'll get into what I mean by that. Digital smile design has been around for a little while. I was trained on it initially probably 10 years ago, and it was fairly cumbersome back then, and it never really fit my workflow very well. And so I'd use principles of it, but we still relied heavily on what we call an analog process. And that's still used in most practices across the world, actually. So what happens in these smile design cases, you'll get one of those molds taken, they'll take those impressions of all that goopy crap. We pour that up into a stone model that represents your mouth. And then typically we'll have a technician just start adding wax to that model and trying to design, ideal shapes and lengths of teeth. And it's just based on a model, right? We don't have any real reference points, and we try to do the best we can. So I had done that for a decade plus in my career, and we found ways of making it work, but it was never as good as it could have been. And it was never ideal, and there's always a lot of finessing and fine tuning. And so during the pandemic, our office, like most offices, was closed for a couple months except for emergency care. And so that gave me, a busy clinician and father of 4, et cetera, some time to say, okay, let's now get this system integrated into our workflow. Let's make sure we have the improvements we need to get the level of care and deliver the results that we need there. I talked to several mentors of mine who've been involved in the digital smile design process from the inception, and got the workflow down, got it all integrated in my practice, et cetera. And so now, almost 2 years later, since we've integrated it, I don't know how we'd work without it. It's so much more predictable, so much more exact on what we're able to do. Literally, we're designing everybody's smile based off their face, right? Which that makes sense. I mean, come on, that's what we should be doing. But we just never had a way of doing it until now.
Wow. So can a patient get a pretty realistic view of what their smile is going to look like then before they leave with the temporaries?
Yeah, so we have 2 ways of doing it. It's pretty cool, actually. And as a patient, and also with kind of my engineering mind, I geek out on this stuff. And so and in Silicon Valley, I have, all the tech people here. They love it, right? It's awesome.
Yeah.
So the first thing that we do with people is once I create this digital design, I'll have them pop back in, or we do it on Zoom now, which is awesome too. And
Wow.
I'll show them what's involved in their design. So all the face photos that we take, all the different angles we're taking, all the lines that we use on the facial markers to create the smile, so that they understand what's going into this customized design smile for them. And then the other thing that we can do on top of this, which is really cool, so after we have designed this smile, I'll 3D print a template of that, and that becomes my prototype for the temporaries, etc.
Wow.
I can also design it in what I call a strictly additive design. So what that means is I can design this new smile so it just goes over the top of their existing teeth. So there's no prep work, etc. So we can do what we call a mock-up procedure. Same thing, I'll 3D print that prototype. They come in and I can put that right over the top of their smile. No prep work with a hand piece or a burr, none of that stuff. And they can right away get a feeling of what that new smile would look like. In most cases, that's going to be a little bit too bulky because in most cases it needs some bit of little reduction, but it gives you a great way of visualizing what's possible.
Yeah, that's amazing. I mean, most dentist offices don't have 3D printers, right?
Very few. It's going to get better, but it's very few at this point still.
That is so neat. Wow. I mean, that's like perfect for your demographic over in Silicon Valley too. I'm sure.
It's amazing.
Yeah. That's awesome. And then I just want to get a better idea of the timing for, the whole process. So if someone comes in and they are doing this, like a smile makeover, reconstruction, what is the timing from that first initial visit to when they leave with their new teeth?
So I answered this question with different options. And so I'm going to give you what my ideal timeline is.
Okay.
And then I'll tell you what I end up having to do more than I would like to, because people are like, hey, I'm getting married in 2 weeks, or like you have to, like this. Yeah. Life happens. And so we try to help people, right? So ideally, if someone comes in for a new patient consult, and actually, I'm going to give a little bit of a caveat right before that. So another thing that I do in my practice for my patients is something called a virtual consultation, which I think we're all getting a lot more comfortable with.
Yeah.
And so part of the challenge people have with my schedule, with their schedules, is getting everything lined up and having to push it out, weeks or whatever till they can get in to see me. With the virtual consultation, patients can go right to my website, upload a photo of their smile, their selfie photo, send me a message of, hey, I'm wanting to, fix this and this and whatever their requests or wanting to improve are. That pops up on my email. I go through and look at, can evaluate their smile based on their photo. And then I will upload back to them a few before and after cases of similar cases to theirs. I can walk them through, what I would do. And then I record a video and say, hey, really nice to meet you, Sarah. This is, what I'm thinking with your smile. This is what I see. This is my process. So give them a really nice introduction of what we're able to do without them having to even come into the office. And typically I'm able to get to those within a day or two. So that's kind of a first step. Beyond that, once people come in for that first visit, we'll do the clinical examination. I'll get all the information I need. We can digitize their face, do our digital scans. I don't use any of that goopy stuff. It's all digital, which is really nice. And then from there, I can start my design process. And depending on the requirements, I can be ready with the design within 24 hours.
Wow.
Or in most cases, I ask the patients to give me 5 business days to finish the design. And so it depends on what we need. People that all right, 5 visits, I'm fine. I'm not in a hurry. Great. Others are, I'm getting married in 2 weeks. Okay, well, we got to make this work somehow.
Yeah.
And so from there, once I have my design done, we're ready to go for our first treatment appointment. And in that appointment, we come in, again, we'll typically do it under IV sedation. You take a little nap, we get all the prep work done, and you'll leave with those temporaries in that are going to be a rough draft of the final.
Okay.
So now we'll test drive that for a week. We check in at that 1 week part. I'd make any modifications we need to make, any changes in color, etc. And then I get to work with my ceramist finishing the ceramic work. And I do have my own lab. So I have my own ceramist. I'm kind of spoiled in that way. I may have mentioned I'm a control freak earlier. Yeah. So
I was like, of course you have your own lab.
so I mean, this gives me a chance to control the product every step of the way, right?
Yeah.
And from the time we do our check-in appointment, make sure everything's perfect, I can have the ceramic ready in as soon as a week. But typically, I'll go 2 or 3 weeks just to make any little fine-tune adjustments we need.
Okay. And with the temporaries, what, like, I'm so perplexed by this because I keep trying to think, like, what are they like? Are they like in there? Like, can you eat as normal? Like what does temporary mean exactly?
So the temporaries, or provisional is another name we use for them. They are basically a rough draft of the final. So they look and feel like the final to a certain extent. They're just made out of an acrylic material rather than the ceramic porcelain material.
Okay.
So it's a material that I can use, and I can form it right away into the patient's mouth. So I have an instant veneer or crown, whatever we're trying to accomplish, that's done right there. They are very strong. They're not as strong as the permanents.
Okay.
And so I always tell my patients, I put them on what I call a fork diet. So if you can cut it with a fork, eat it. Anything beyond that, you might want to be careful. Just because they're acrylic, right? They're not the strong ceramic. They are bonded to the teeth. They're not coming in and out. They look great. I've had patients get married in veneers. It's not my preference, but it's happened. And so it just depends on, what our goals are for each circumstance, each individual. But they look great.
Okay. Yeah, I've always been like, so they put the temporaries in, and then you have to have a procedure to like take them out and then put the other ones in, right? So it's kind of, it's a process.
So after and again, and this is such an important step, right? And having this ability to test drive the new smile in your mouth, despite all the efforts that go into the design process, I tell people, I still consider this a rough draft, right? I want to see it in your mouth, you using it day in, day out, how your lips are moving with it, getting feedback from significant others, you evaluating it in the mirror every day. Because when we put these veneers on, it's such a permanent type procedure. Right. We want to make sure it's perfect. Yeah. And we're so lucky in the dental world compared to like my plastic surgeon friends who it's like they just kind of, you go, right? I mean, there's no way to test drive a lot of these surgeries, these plastic surgery procedures. Whereas with smile design, we can test drive. So we're really lucky in that sense.
Yeah. I think that's fascinating. I mean, and with the changes that you're making afterwards, it's probably minor, right? Like you said, you're tweaking little things. And I'm curious about the whitening aspect. Do you whiten with every single one of your procedures? Like if you're doing a smile makeover, does that always include whitening?
So usually, and it depends. So for example, if we're doing veneers just on the top teeth and we're not doing veneers on the bottom teeth, then most patients will want to whiten their lower teeth to get the color a little bit lighter. So there's less contrast between the top and bottom, because typically we're going to go to a lighter shade on those top teeth. Okay,
that makes sense. And another question I have for you. So you have said that the celebrity smile that most of your patients refer to when they come in and ask for, like, who's your smile inspiration or whatever, is Heidi Klum. And I was just curious why. Like, what do you think makes her smile so desirable to people?
Well, I think part of it is actually kind of like the emotional side to who she is. So she's a happy person, right? I think she's got a really big, beautiful smile. So I think and I'll get into the shapes a little bit more, but I think even before you talk about like the shapes of her teeth, etc., just the way that she smiles and she radiates, people are drawn to that. Yeah. Right. So I think that's one of the reasons I hear that often. And then as you look at her teeth and her smile, she has a very youthful look with the teeth and the shapes and a lot of nice symmetry and things that look very beautiful but very natural. Mm-hmm. Often, and it's a function, I think, of, again, where I am geographically, but the majority of my patients that come in, they're like, look, I want a beautiful smile, but I don't want it to look fake, right? I don't want a fake smile. I don't want, and I even hear sometimes, not to disparage my friends in Southern California, but I don't want that Hollywood smile, right? I don't want the real white, everything's straight, everything's the same length, etc. Yeah. And so that's, that's something that I see with Heidi Klum. She has a very natural, beautiful smile.
I think they used to call them chicklet teeth, right?
I still hear that.
Really?
So I don't want to look like chiclets. And I said, well, if that doesn't look natural, then I've failed, because yeah, I want to make sure. And every once in a while, I mean, maybe a couple times a year, I'll get a patient that they do want that Hollywood smile. They want the real white, and that's fine. But again, I'll test drive on it, that smile on them. I'm like, let's test drive it. Let's make sure that's exactly what you want, and then okay, off we go.
Yeah. That's so cool. I think what you do is so awesome. And definitely agree with you on the, the confidence, like boosting and of the aspect of what you do. Like when you said that you chose to specialize in these procedures and not offer the other stuff, like I get it. You are really changing people's lives. And, I've been with NewBeauty for almost 10 years, and the stories I've heard about smile makeovers have been some of my favorite stories. Just people who never smiled, never wanted to be in a picture with friends. They were just so self-conscious, and then they had a smile makeover and felt like $1 million every day. And I just think it's so cool. So
well, I got to share with you a story about that, because that I literally just had, I mean, this happens all the time, but my last patient I saw on Thursday, I don't work Fridays typically, so it's my last patient of the week last week. She came in and she had veneers done years ago. They weren't great. And as we were talking about before with the function aspect, that wasn't addressed with her. And so she was breaking things, had actually broken a tooth, etc. It was bad. And she came in very much almost like, really reserved, had a hard time even talking to me about her experience, didn't want to smile. I mean, she was a very much, I thought she was just a really shy I couldn't tell, I couldn't tell what was going on. So we go through this process. We just finished, and I'm going to show you, I have it on my iPad here. I'm going to show you the picture I took with her on Thursday. Okay. And I'm going to talk about the difference that I see here. So let me see if I can get that right.
Oh, yeah.
So that's her. You can see a huge smile. And I was talking to her on Thursday about her transformation process, and I almost started getting emotional, because I said, you're a different person today. She just got a new job. She's, like outgoing, like that smile never stops, has so much more confidence in the way she addresses people and talks to people. It literally was a person transformation, not just a smile transformation.
Yeah.
To see that and be able to do that, I mean, I'm so fortunate. It's amazing. It's amazing the impact it has on people.
Yeah. I'm glad you made the move from mechanical engineer.
It's worked out.
Yeah.
It's worked out.
Is there anything that I left out, or any procedures or trends that you're seeing that you wanted to talk about that I didn't mention today?
I think it's interesting with the whitening trends that are out there. I think people need to be careful with some of the whitening stuff that's going on. There are some products that are being used that really shouldn't be used for whitening. TikTok's not helping us there. So whenever someone's wanting to explore smile enhancements, whether it be whitening, little veneering, big veneering, whatever the case may be, I always recommend talk to an expert on this. There's a lot of weird stuff out there, and it's not any different than what you hear in even the plastic surgery world of some weird stuff that happens there. Beauty enhancement is an important part of our society and what we do. Do it the right way. Yeah. I mean, invest in yourself with people that are experts in the area.
Yeah. No, I love that advice. We're constantly calling out the TikTok trends too on newbeauty.com. What is, with doctor quotes and insights, so that people, know the real scoop behind those videos.
Yeah, I appreciate that. Get the right information out there.
Of course. Well, thank you so much for your time today. And for everybody who's tuning in, we'll be saving this live on NewBeauty's IGTV network. So if you want to go back and look at anything after, reference anything that Dr. Field had to share today, you can do that. And also check out our brand new issue with Beth Bears on the cover. It just hit stands last week. Love her so much. She's great. And you can see Dr. Field's profile in the issue as well. So thank you so much, and hope you have a great week, and we'll talk to you soon.
My pleasure. Thank you. Appreciate it. Have a good one.
Of course. Bye.
Bye.
Thanks, everybody.